last time.
All right, it looks different.
Yeah, I know. I think we made it.
Oh my goodness.
Y ahora sí ya le vas a iniciar, ¿no?
There we are.
Okay. We don't have any people.
Yeah, I know. I think we made it.
Oh my goodness.
We don't have any people.
Yeah, I know.
Entendido.
I think we made it.
¿Por qué vamos atrasados?
We don't have any people. I know.
Why does it keep saying that over and over?
So, Ricky, I think we're live now.
Why does it keep
Okay.
saying that over and over?
Let me see. So, Ricky, I think we're live now.
Why does it keep saying that over and over?
Let me see. So, Ricky, I think we're live now.
Why does it keep saying that over and over?
Pero dejé de ver de Zoom.
So, Ricky,
Why does it keep saying that over and over?
okay. Let's see. Can you hear me now?
I hear you good. I don't hear that playback anymore.
Okay, great. We're about to start the webinar.
Okay.
Let me see if there's, there's.
Ya, ya empezó.
Okay. So we're here in Mexico. This is Verita Neuro, Mexico. I'm Dr. Rodrigo Vilches. This is Dr. Paulina Marin. And this is Ricky. Ricky had been with us for epidural stimulator recently. And we're very glad to have you here, Ricky, in this webinar. At last, we could do it.
Thank you for having me.
You're very welcome. Ricky, tell us a little bit about yourself, about how you got injured, where do you live, a little bit about yourself in general, please.
Okay, well, I'm 35 years old and I live in Katy, Texas, which is pretty close to Houston. I have a wife, an 8-year-old son, and a 7-year-old daughter. And the end of last February, I was at a birthday party at a friend's and dove in one time to a pool next to the neighbor after he dove in, and I hit the shallow end and one jump and broke C6, and they caged C6 and put a rod from 6 to 7. That was definitely life-changing, but you know, it could have been worse for sure. Having 2 kids is a huge motivation, and my wife's been a good support, and I feel like I'm luckier than a lot of people I've met. So hopefully this can reach people's ears and I can motivate others, because it's a tough injury for sure.
Sure it is. Ricky, how long ago was your injury?
Last year, February 27th. So I'm in about 1 year and 6 months, some months.
So after you had the injury and they did the surgery, how was your motor functions and in general your functions?
At the ICU, I really could only move my arms like barely at all, and then I went into like a medically induced coma for like 3 weeks when my lungs shut down. And when I went to TIR, I was there for a month, maybe 6 weeks, and I really didn't have much function at all. Like I couldn't move my arm. Once it got to here, it'll just fall, and nothing from the chest down, no fingers, and my core was horrible. If I sat on a mat, I would fall in any direction. Since then, up until I came to Verita at about the 1 year, 3 month mark, I was able to get a lot of my arm function, but not 100%. So like my tricep only worked 20%. My forearm didn't work, but the upper forearm did. My shoulders and back were probably the strongest of anything, but nothing works 100%.
Okay. And did you do a rehab in the last year after your injury?
I go to therapy 4 to 5 days a week for 2 hours. I do an hour OT, hour PT. I luckily found an awesome therapy place. I will tell anybody, like, picking your physical therapy place is a huge asset if you can find someone that has like a good team and a good home, because the more you can motivate yourself to work, the better you recover, is what I see. And a lot of guys struggle with depression or being down. It helps to have good teams around you, for sure.
Do you feel a difference before rehab and after rehab in your injury?
Verita part or just physical therapy here?
No, physical therapy.
Yeah, you can definitely. I've kind of noticed it's a slow road. So it's, most people want instant gratification, and this is, you have to work really hard and not expect to see big results. But when you look back every 6 months or so, you can be, man, look what I can do now. Today at therapy was the first time I was able to transfer back and forth on the slide board. So I'll start driving here this weekend. So, it's a year and a half, and 6 months, 8 months ago, I would have never thought I would get to that point. So
how did you find about us? How did you find us?
my wife actually found y'all. There was a few things floating around Facebook, and a couple quads had kind of heard about this new stimulation thing. And my grandma, after I got hurt, actually mentioned it to us, and I kind of shrugged it off because it wasn't in the United States yet. But once my wife found it back in January, and we did some research, and I was starting to see a little recovery from therapy, so I wanted to give myself the best shot. So when she started digging into it, I kind of pulled the trigger on it.
Okay, great. Since you start hearing about us and you decided to come, what were your expectations?
To be honest, they're kind of all over the place, because with this injury, you wish there was a miracle thing that would fix us. So initially when I heard about it and I saw people walking with crutches, your expectations kind of start really high. Like, I was hoping it would be a big fix, and I kind of tapered it down some because I didn't want to be let down. And so I tried to go there with minimal expectations, but I expected it to help. I wanted it to help a lot.
Okay. So you finally decided to come here. How was you arrived to Mexico. What do you think about Mexico before? Have you been here in Mexico before?
I had never been, no, and I was going to go to the Thailand location, and Mexico is so much closer logistically, and that was a big reason I chose Mexico. I'm glad that I did now, because from the minute I got there, it was pretty much uphill from the moment, from being scared to actually getting there and meeting Paulina and the neurosurgeon, and the surgery, and it just got better and better the whole stay. And after I was done, like, there's no doubt I would do it again. Like, it was an amazing experience for me.
Yeah, good. How was your surgery?
It wasn't bad. I mean, I've had a big broken leg surgery and then neck surgery. I mean, it was pretty much like outpatient more to me, because 2 hours went by and I didn't have a lot of pain from the surgery, and I was able to start training and doing stuff pretty quick. So like, the incisions are minimal. It was not as invasive as I thought, thinking of wires having to get threaded under your skin. I didn't know if they're gonna have to open me up, so I was happy with how minimal the surgery is.
Can you tell us a little bit about the first week after surgery?
The first week is more pairing, so it's a lot of your initial turning things on and seeing. And to be honest, the first day or so when I was getting shocked, I was like, oh my God, what did I sign up for? Like, getting electrocuted. And it's a big difference for people that can feel or don't have feeling, because the guy I was there with, Juan Carlos, did not have feeling, and so he just felt pressure and things would move, but I can feel everything. So if you're thinking about doing it and you have feeling, just be prepared. It's a shock at first, and then your body gets used to it. So by the end of that first week, I had kind of picked up on what they were trying to do with the electrodes and the pairing. And it was, after like day 2, it was pretty exciting, because you got to see your leg move and your hand close for the first time. So there was a lot of really cool moments that first week. Ones I won't forget for sure.
So what do you think was your biggest challenge after getting the stimulator?
Probably at here at home, I don't spend as much time as I probably should on my body. So the adjustment of being 5 hours a day and pretty much dedicating your whole 2 months to your body. I mean, it's wake up early, it's workout, and I mean that's your whole day. You know, you have evenings to yourself. So that was a big challenge to get that routine. But once I got it, like it was awesome. Now I'm trying to replicate it at home now.
Right. You were discharged not long ago, Ricky. How's your actual physical state? How are you feeling? What can you do right now?
When I was there, you know, you kind of don't notice change as much when you're in the moment because I'm doing new things there the whole time. So when I got home and went to therapy and was doing things at home that I hadn't done in 2 months, was really shocking at how much stronger I am. Like the therapists at my place were just blown away with, you know, the jump I made in 2 months. Being able to transfer today was something we were thinking was a year out, 6 months out. And the weights levels I'm doing for triceps, and when I transferred, I'm actually able to lift my entire body off the ground. And so I've noticed huge changes being at home, strength wise.
So one thing that is very important for us, Ricky, is that after you get discharged, you have to do a physical therapy program at home. Are you doing that?
Yeah, so I started setting it up before I left Mexico because I wanted to keep replicating that so I didn't lose. So I found the same type weight set that people see on YouTube on my videos to get in the garage so I can do in the mornings. And then I did my therapy from 4 days to 5 days a week for 2 hours. So I could get about 4 hours of work there. And then I tried to do an hour each day of program work, turning on certain programs that I don't use as much because you have 12 programs with each stimulator, but I probably only really use 5 or 6 of them a lot. So I need to turn the other ones on. So I tried to get my 5 hours every day.
Okay.
Ricky, can you tell the people a little bit how did you prepare before the surgery, like physically and everything?
I've noticed you want to be in the best shape you can be because most people say technique, but that's only part of it. You need to be healthy and you need to be in at least the best shape you could get in yourself before going, because the better you are, the more you'll get out of it. You know, you don't want to spend the first month trying to fix things that you could fix at home. So if you do the MRI and you're going to get started, be on a good diet and push yourself as hard as you can before you get there so your endurance is up and you can handle it better.
Yeah. Here in Mexico, I want to ask you, Ricky, what's your experience with the hospital and you know, in general with the installations and the facilities?
The hospital was incredible. It was actually a lot nicer than I thought it was going to be. The room was awesome. My only thing was the bed. My wife wished it had a more comfy bed. So we ended up buying a little air mattress thing that made it way better. So just think about that. But the facility was awesome. And I know y'all aren't going to use the hotel anymore, but I loved the hotel as well. I mean,
excellent.
The way they have it set up from just going to your room down to work out, it makes it very easy. So I loved it, how it's set up.
Good. So in general, how do you describe your experience here in Mexico?
Probably the first thing I tell people is the team. Like, they ended up being family to me by the time I left, and by the mappers, the PT, to the nurses, to Paulina, it's really like you have a team of people looking out for you. I mean, if you're not feeling well, or if you need to get motivated to push harder, or if you want something accomplished, they will work on it. I mean, they're all assets for you, and they really become best friends in 2 months. So that was my biggest thing. And then just the outcome of how it worked out. I mean, my upper body, how I work out is something I didn't think I would get back. And being able to hold weights and do workouts and then stand and work on my core for 20-30 minutes at a time, I didn't think was possible. So the people and then the actual procedure were way above my expectations by the time I left.
Ricky, if someone with a spinal cord injury similar to your condition is watching this right now, what's your message? Do you have a message to them?
If you can do it, I would say do it, because what I've learned is the more you can put into your body in those years and dedicate to yourself, the better your life will be. And most of us are young that have this injury, or relatively young, and you're going to be 30 years living with this. So if you know you need to bust it for a few years or 5 years, do everything that you can. And this was a big one that I think is going to catch on because how well it works.
Excellent. Let me see if someone have questions, Ricky, that we can answer, or you can answer. Let me see.
Yeah.
Right now, I have no questions about the epidural stimulator or the program. Let me see if here we have something.
Are y'all all in the hospital now, Paulina?
Almost.
Not yet, almost.
Almost.
In about 2 weeks, we're gonna be there.
Do you have a patient there right now?
Yes,
Yeah.
but we have patient in the hotel.
Okay.
Yeah. So we have no questions.
No.
Ricky, I like to thank you very much for your time.
Yeah, for sure.
For the patience when we start this webinar.
Yeah.
And for joining us and your sharing your experience here in Mexico.
For sure. I would definitely say though that all the quads. Say that again.
Sorry. So one question is, where does this procedure is done? This procedure is done in Mexico, in the city of Guadalajara. And how can you get in touch with us? You can get in touch with us through the Facebook page or
Instagram, also Instagram.
Yeah. I'm gonna say it in Spanish because the questions were made in Spanish too. Una pregunta fue dónde se hace el procedimiento. El procedimiento se hace en México, en la ciudad de Guadalajara. Y cómo se pueden poner en contacto con nosotros. El contacto con nosotros se pueden poner a través de nuestra página de Facebook o de Instagram. La página de Facebook es Epidural Stimulation Now. Y a través de esa página se pueden, de hecho estamos transmitiendo en vivo a través de esa página también. If someone else has any questions, any participants, please, now's the time to, if you have questions for us or for Ricky, now it's the time.
It says at the bottom of my screen, it says 10 participants, 6 questions.
Yeah.
You see those?
Yeah.
Yes.
We're answering those. Yeah. Thank you.
Okay.
So.
And definitely like the quads here, like, and the people y'all have sent that I talked to, I mean, we're like kind of a family and look out for each other, and we're all learning and trying to figure stuff out together. So feel free to always ask for my number or reach out to Verita and they'll give you my contact, and I will answer anything you want to know or encourage you whenever you need it. We need to stick together as much as possible.
We appreciate that, Ricky. Thank you very much.
For sure.
Thank you very much for sharing.
We're just waiting to see if we have any more questions. And a ver en Facebook.
10 questions.
Yeah.
Ahí está.
One question is, Ricky, can you move your legs and can you stand up?
I had no movement from the waist down. I'm in minimal core. So before I went, I could only stand in like the parallel bars for like a minute at a time, and blood pressure would drop. And with the programs on, by the end, we started to get where my knees and hips could lock and they could let go. And I starting to work to be able to stand on my own with just assistance with holding something. And now I can stand 30 minutes at a time, 20 minutes at a time. And with the programs, I can kick and move my legs, but not without the programs, no.
Yeah.
Ricky nos contesta en cuanto a tu pregunta de mover las piernas, que antes no podía realizar el movimiento, ahorita lo puede realizar el movimiento de las piernas con los programas encendidos, así como antes solo podía mantenerse 1 minuto de pie con apoyo y barras, y ahorita ya puede mantenerse hasta 30 minutos bloqueando por él mismo las rodillas con la asistencia de las barras paralelas con el estimulador encendido.
There's a question for us. Probabilities of walking, changing my injury is C5-C7. Well, I'm gonna say it in Spanish because the question is in Spanish, and then I'll translate to English, okay? La probabilidad de cambiar depende de cada paciente. Lo que nosotros hacemos es un tratamiento médico en donde se coloca un estimulador a nivel de la médula a través de una neurocirugía, y eso tiene el potencial de devolver la movilidad en ciertos segmentos del cuerpo. No es un tratamiento que quite la lesión medular, pero sí es un tratamiento que le da la posibilidad a la gente que tiene lesión medular de tener una mejor calidad de vida, de poder mover más músculos y de poder hacer muchas más cosas. Entonces, la probabilidad o la posibilidad que hay de cambiar la lesión depende de cada persona, depende del tipo de lesión, del nivel de lesión y de la afección y del tiempo de evolución. Para contestar tu caso en específico, te recomendamos que te pongas en contacto con nosotros. Podemos analizar tu caso de cualquier día y con mucho gusto, y darte una respuesta específica para tu lesión. So in English is the possibility to change an injury. It's the epidural stimulator treatment that we do is it's a medical treatment that doesn't doesn't stop or modify the injury, right? So it's, but it can, you can regain some movements in some segments that you don't have right now if you have an injury. So it's not a cure for the spinal cord injury, but definitely you can improve your movements and your quality of life. Right? Okay.
For sure.
Question from a patient. How about bowel and bladder? What improvements did you see so far, Ricky?
I have not. I got a UTI right when I left, so I've been dealing with that with antibiotics. So I haven't started trying to do it myself yet, but I'm at the 3-month with the stem cells. So that's my next thing I'm going to start working on. I want to get driving, and then I'm going to start cathing because I cath myself, but I want to start trying to avoid myself without cathing. So I will make an updated video or keep y'all posted how that goes.
So yeah, thank you. So in general, Ricky has been discharged not that long ago. So that's why maybe he hasn't had this time to start doing this. In general, patients have improvement in the bowel and bladder control with epidural stimulator. It depends on each patient, but in general, we have improvement with this.
Because it kind of what I figured it is, it's getting your body to move and contract lower than your injury. So you're flexing your core a little better, you're getting things to move better. So your bowels move better and you have more muscle tone where you might not think with bladder control or anything like that.
Okay, I think we don't have any more questions. Y si se quieren comunicar con nosotros, tenemos las páginas de Instagram, Epidural Stimulation Now, Facebook Epidural Stimulation Now, y también tenemos contacto por WhatsApp. Si nos pueden dejar su teléfono, con mucho gusto nos contactamos con ustedes. También está mi Instagram directo, Pau Marín Epidural Stimulation, también por ahí los podemos ayudar. And in English, we can help you in epidural stimulation now on Facebook and Instagram. And also our personal Instagram, Pau Marín Epidural Stimulation, and that's all.
That's all.
And that's they're a good team down there. So you ask them questions or me and you'll be happy with it.
Yeah.
I will refer it to anybody. So anybody that calls and talks to me about it, I always speak highly of y'all. So thank you for having me.
Thank you, Ricky. We appreciate that very much.
Yes, sir.
Thank you, Richie.
All righty, have a good one. I'll talk to you soon.
You too.
You too. Thank you for joining, everyone. Thank you for joining this webinar. Thank you, Ricky. We'll see you in the next webinar. Bye-bye.